Ever since I was a child, couldn't be myself. Had to represent the image of someone else. Now it's time to take control of my mental health. I can't believe I even let this all affect me. I don't wanna be like nobody else. I wanna be different. And if that means I gotta do this by myself, well then I'd rather be a misfit. Had me feeling like I never deserved this. Everything I do is absolutely worthless. Turn around and feeling like I was deserted. Had me feeling like I had to leave this earth, kid. Now I'm looking at the world through a new lens. Had to gotta separate for some new friends. Feeling better now, I just wanna let you know. Don't cry when they find me on the phone. If you don't understand what I'm saying, one day you'll find out. Eventually the greedy need a bigger mouth. Chew you up and swallow, then vomit out. That's what they live for. Listen, I can tell what you're missing. Vision, don't regret that decision. Feels just like a head-on collision. Misfit who I be, never question. Living since I was a child, couldn't be myself. Had to represent the image of someone else. Now it's time to take control of my mental health. I can't believe I even let this all affect me. I don't wanna be like nobody else. I wanna be different. And if that means I gotta do this by myself, well then I'd rather be a misfit. Ride a roller coaster, no, never will again. Forget anyone bringing around the negative. I just wanna find a way to stay positive. I can't believe I wasn't addicted to acknowledgement. Now it's all about happiness, sunshine. Not a single rain cloud in my sky. Take a breath, step to the side. Somebody lend a hand, cause I'm drowning inside. If you don't understand what I'm saying, one day you'll find out. Eventually the greedy need a bigger mouth. Chew you up and swallow, then vomit out. That's what they live for. Listen, I can tell what you're missing. Vision, don't regret that decision. Feels just like a head-on collision. Misfit who I be, never question. Living since I was a child, couldn't be myself. Had to represent the image of someone else. Now it's time to take control of my mental health. I can't believe I even let this all affect me. I don't wanna be like nobody else. I wanna be different. And if that means I gotta do this by myself, well then I'd rather be a misfit. Living since I was a child, couldn't be myself. Rather be a misfit. I don't wanna be like nobody else. Rather be a misfit. Living since I was a child, couldn't be myself. Rather be a misfit. I don't wanna be like nobody else. Rather be a misfit. If you don't understand what I'm saying, one day you'll find out. Eventually the greedy need a bigger mouth. Chew you up and swallow, then vomit out. That's what they live for. Listen, I can tell what you're missing. Vision, don't regret that decision. Feels just like a head-on collision. Misfit who I be, never question.
Hey y'all. Hey Chaotic. How's your day been? Okay, so we're gonna go over like different I don't want to do that. Different chronic illnesses and stuff. And I just picked the 3 that I know that I have, and we're still finding out more. Because then it goes into, I'm not saying all medical professionals, but shitty people being in a line of work that, if you're a shitty person, don't be in a position that you're supposed to care, pretty much. Mine has been tired. I started going back downhill from being sick last week, but I need to get on and stream. I really do. So I think I got my fever back. I definitely have congestion back. And my throat hurts. So we're going through another round of this crap. But, I mean, I can stay conscious this time at least. And these are just the 3 conditions that I know, like, that I have. If you guys have any, say yourself, that you want people to be more educated on, that you want people to know more about, that you think that would be beneficial for me to cover, completely fine with doing that. You can get a hold of me on Discord, which it should be in the bio, and or I'm on TikTok, and you can DM me there. It's the same name over there that it is here. So you guys can find me there and just send me in what you got, and we'll do it that way. But I'm very tired of that's what a lot of people's issues is that everything gets thrown at anxiety, and I hate it. Do I have anxiety? Yes, but my anxiety would probably be lower if I knew what was going on with my body. Just saying. But yeah, so we're going to go over that stuff, and then if you guys have something different that you want education on, totally down for it. But yeah, we got the education part, and then it'll go into the shit talking part, like I like to do, because I am a huge advocate for being able to shit talk. I'm just saying. Okay, I need to put this like right here. And then I thought this was funny, so I wanted to start with it. It's chronic illness explained by ducks. For those people that don't deal with it. Chronic illness and chronic pain.
Explained by ducks. Duck look fine. Duck not fine. Energy limited. Like battery never above 30%. Wake up tired. Plan day carefully. Shower cost. Conversation cost. Grocery trip cost. Spend worms just to exist. Other ducks say, but you were okay yesterday. Yesterday used tomorrow's energy. Symptoms invisible. Pain quiet. Fatigue heavy. Chronic mean long-term. Not dramatic, not temporary. Wise frog sit beside duck. Say, your capacity is different, not lesser. Rest is strategy, not failure. Some days more, some days less. Still duck show up. Still duck float slow. Still a good duck. Chronic illness.
I don't know why, but that like hit home. Just made me feel good. Longest possible ways to get diagnosed with lupus. So, a lot of times you have to give doctors the idea. They're not just going to throw stuff at different tests. The way that I had to do stuff was, obviously, I went and got a new doctor. I love my doctor now. She listens to me. Completely understands where I'm coming from. But there's different things that I would have to look at and then relay to her, like, hey, a lot of my symptoms align with this, or they align with this. And then she would do the test. But a lot of that is also because most of the time I haven't been insured. I am now, thankfully. And she didn't want to break my bank. She's very conscious about that. And she always checks to make sure that my insurance will cover said test. A lot of the time, the reason they don't do all the tests at once is you have to do this test and then get a negative result. And then you can do this test for insurance to cover it, if that makes sense. A lot of these are... So, like, doctors and nurses are very restricted on what they can do by your insurance, especially if it's state insurance. I do know that part for a fact. And insurance companies are worse than a lot of the doctors and nurses that I'm going to show. So, if you guys want more education on your stuff, I will, for our shit talking segment, I will put, like, insurance stories for that one. But I wanted to be completely transparent with this one. So it's not just providers that are the problem. It is not just nurses. It's both. It is also patients. You also have to keep in mind different people that these people see. Does that excuse some of the stuff that you're about to see from doctors and nurses? No. But no person should act the way that the patients I have on here act either. It's just either you're a patient or a doctor, just have compassion and care and, you know, don't be a total dickbag.
Fibromyalgia is not a pain disease or some psychiatric disorder.
So the first one we're going to go over is fibro, which is normally a comorbid. I hate that word. It makes it so hard to say. Comorbidity with a lot of other problems. The whole reason I didn't have the skin pain at first when I was first diagnosed with it. I do now because it's steadily gotten worse. But what I had was my skin itched like everywhere.
It sure as hell isn't something that your rheumatologist should dismiss because your blood work looks normal. Your body has a pain processing system that's broken. Let me explain how fibromyalgia works. Your brain, spinal cord, neurotransmitter systems, they all work together to determine what's actually painful. Now, in a normal person, this system is calibrated. You touch fire and pain, you pick up your phone and no pain. In fibromyalgia, the system's gain is cranked up to like 800. The brain is processing non-painful stimuli as if they're catastrophic threats. 2024 Exploration Medicine showed fibromyalgia patients have elevated substance P levels 3 times higher than normal in their cerebrospinal fluid. Substance P is an excitatory neurotransmitter. It's the signal that says pain. And this is important. 2024 PMC proved fibromyalgia involves the dysregulation of 3 neurotransmitter systems: serotonin, norepinephrine, and dopamine, all depleted pay attention, in the spinal cord at the level of descending antinociceptive pathways. What does that mean, Dr. Trevor? It means that the system that's supposed to shut down pain is broken. 3 biological failures, again. In fibromyalgia, pro-inflammatory cytokines are chronically elevated and the immune system is permanently turned on. And to be honest, 90% of the time from previous infection. Epstein-Barr, Lyme, COVID that biology couldn't fully clear because of NK cell dysfunction. So the inflammation amplifies pain signaling, activates microglia in the brain, and drives the systemic symptoms. 2024 Exploration Medicine proved fibromyalgia has impaired glucose metabolism. Pain processing is metabolically very expensive. When insulin signaling breaks down, the thalamus, the spinal cord, etc., they all starve and the system fails. In ATP shortage, the immune system can't regulate, so inflammation. Nervous system can't maintain proper pain gating, so pain amplifies, and the muscles can't produce energy, so fatigue. They're not separate problems. It's one cascading failure across multiple systems. And here's something they never dig into. Fibromyalgia predominantly affects women. Why? Because estrogen and progesterone regulate GABAergic and glutamatergic balances in the brain. GABA is inhibitory, glutamate is excitatory. When estrogen is high, you get more GABAergic tone. When estrogen is low, you get relative glutamatergic dominance. So during high stress periods, combined with low estrogen periods, the brain gets stuck in this hyperexcitable state. The thalamocortical loop, which is the circuit that processes sensory information, goes into full pathological mode. That's why fibromyalgia peaks perimenstrually, postpartum, perimenopause. The system is primed by stress and then triggered by the hormonal withdrawal. Listen, you're not broken or crazy or weak. You have a real disease caused by real biological failures. It's reversible. I've used this protocol a ton. I gotta go comment heal for the research. Never miss.
Now, I don't agree with you can heal fibromyalgia. You can lessen your symptoms. Okay, there is no cure for this. You can do things that will help subside it, things like that. It is a neurological and nerve disorder. Okay, that's why like today, like I am not fine today. I'm just throwing that out there. But like today, I could be totally fine being able to walk down the street, no problem, nothing, right? The next day, I could be laying in bed and not be able to move because of this, because it inflames everything. Where there shouldn't be pain, there's pain. Like, you should have seen my reaction to, what do you mean there's people that wake up and just, they don't hurt? I don't understand. Like, that, at no point is that ever my day. Ever. And if I could tell you how many blood tests I have gotten back saying that, no, you're fine. Nope, you're okay. It drives me absolutely insane. And then on top of that, the main reason that I got diagnosed with it was the widespread of pain, and especially pain that moves. But my doctor ended up she focused on how high my inflammation always is. I am constantly inflamed. Like that sedimentary rate that shows your inflammation, that never goes down. And it's just, I am constantly inflamed, and that's with taking anti-inflammatories. So there's the breakdown on that one. Which, there's multiple, so give me a minute.
I had to cover this disease. I have never seen a group of people, primarily women, be more gaslit.
And also, doctors will tell you if you have fibro, it does not exist. Not all of them, some of them will. They will tell you that it does not exist. And that basically you're cuckoo for Cocoa Puffs. Don't do that. That is completely dismissive. It's documented. It's probably a pitch, yeah. Like, there's a couple of them. It's probably a pitch to a product. I do think that some of the holistic things will help to subside or lessen some symptoms, but there's no cure for this.
About their disease and their level of pain than this group. How would you feel if you were in pain all of the time and just people and doctors told you, oh, that's not a real thing. There's no test for it, so how can it be a real thing? Well, your labs are normal, so what's your problem? Yet for the 13 million people suffering from fibromyalgia, they do not feel heard, they do not feel seen, and they feel like they're in this alone. I'm Dr. Erin Nance, a board-certified orthopedic surgeon, and I cannot believe it, but today is 31 of my 31 for 31 series on the most commonly misdiagnosed conditions that affect
I'll show it to you later.
Fibromyalgia is thought to be a neurological
that it has
condition,
anti-inflammatory and it helps so much.
Not an autoimmune or inflammatory condition similar to many of the other diseases I've covered. Basically, the pain signals are turned way up in your brain. Your nerves are reporting to your brain that there is pain when there's no reason for it to be. Some of the common symptoms are widespread musculoskeletal pain, fatigue, brain fog, insomnia, mood issues like feeling depressed or anxious. And there are multiple other conditions that it can coexist with, including...
Now, bringing up brain fog, I want to make sure everybody knows, I'm not talking about forgetting where you set your keys. Like Tuesday and Thursday. It's not just things like that. I have been driving and literally sat there and went, oh, where was I for the last mile? And I cannot for the life of me remember the last mile that I drove. I know I was aware, but there's nothing there. Or sometimes my words won't work right. And I have a hard time talking. So, I mean, those are more brain fog. Yes, it's forgetfulness and things like that, but it's also confusion. It's not being able to find words. It's a bit more severe than just being forgetful.
Chronic migraines, irritable bowel syndrome, painful bladder syndrome, and POTS. Now, for some medical professionals who don't believe in fibromyalgia, their concern is that there are other conditions that people are being misdiagnosed with fibromyalgia, but they really have other medical conditions. Now, this is...
Right? The brain fog, it makes you feel like you're dumb. You're not. I like to think of myself as... I educate myself very well, I believe. I pay attention to facts, not just opinions, and I try to form my own. And different things like that. But if I'm in a brain fog flare, you wouldn't think that I passed the 3rd grade. I can't form a sentence correctly those days. And it messes with you later, like, am I really that stupid? And you just have to remember you're not. It's not that you're stupid, it's your brain is having issues retrieving the information that you have.
Also, a really important list to know about. This is the list of diseases that fibromyalgia can mimic. Rheumatoid arthritis, ankylosing spondylitis, Lyme disease, lupus, multiple sclerosis, thyroid disease, and chronic fatigue syndrome. So what often happens is that doctors will be spending thousands and thousands of dollars on all of these labs and blood work and imaging studies that is going to help rule out these other diseases, because fibromyalgia doesn't have a blood test or an x-ray to use to diagnose the disease. So it can be a very long process of diagnosing fibro because it is considered a diagnosis of exclusion, meaning we've ruled everything else out. And this is a really important point that one of my followers emailed me when she found out that I was talking about fibromyalgia. She reminded me that even if you have a diagnosis of fibromyalgia, you may still be at risk for developing another autoimmune disease or other type of inflammatory disease as you get older. So if you develop new or different symptoms, don't just blame everything on your fibromyalgia. You should also be tested for these different conditions because you may have two things going on at once.
And don't let your doctor either just try to say, it's because you have fibro, it's because you have fibro. You can always say, I get that this is also partially part of fibro, but this is more constant. I want the test. And there are ways to do that without being crappy. Right? So advocate for yourself on it. If you think something more than just fibro is going on, make sure that you are advocating for, I want to be sure. Because this does mimic so many things, and it is a comorbidity to a lot of things. As like an add-on, like, hey, you get a bonus. It's not the bonus I wanted.
But the most important part of this video is for those who are suffering from fibromyalgia to know that we see you, we hear you. And if you have fibromyalgia, please share your story. Please let everyone know what it's like to live with this disease that is so difficult to diagnose. You never know who's watching these videos. And as I close out this 31 for 31 series, I want to thank each and every one of you who has viewed my videos, shared it with someone that they love, made a comment, messaged me directly. It has been an honor and a privilege to serve this community, and I will be continuing this series of awareness and advocacy, maybe after I get a good nap in. Thank you so much for watching. It's been a privilege.
So I like the series that she did because it was 31 different diseases that mostly affect women. They can affect men too. It's just that usually it's more tipped in women's direction. Especially because I do feel like we get pushed to the side more. Like, oh, you're just being a baby. No, I have had children. I know what real pain is. Do not call me a baby. You do not know the pain I have had in my life. No. I am not coming to you with a stubbed toe. I am coming to you with, I feel like I am dying. But I do, if anybody is wondering if they might have something, if something isn't making sense, go over to her TikTok page, watch the 31 for 31. It's actually what started educating me on a bunch of stuff that I have. I've always had this symptom, and now it makes sense.
Seven unusual symptoms that could actually be fibromyalgia. Remember, fibromyalgia is caused by an abnormal sort of pain processing that people with fibro have. They oftentimes sense pain more strongly than others. 3 hallmark symptoms that we have always known about are chronic widespread pain, number 1. Number 2 is fatigue. Number 3, problem sleeping. And there are other symptoms as well. But some unusual symptoms that may also be a part of fibro include a deep aching pain or burning pain that tends to get worse with the weather or with stress.
So I always called these hot spots. Okay? It would literally feel like my skin, and it's usually on my arms, where it feels like my skin is burning in that spot and I cannot stop itching it. And the worst part is I have given myself scars from these. It's because it's a burning itch, like on my arms. And we found out that's from fibro.
2, muscle stiffness, muscle spasms. Number 3, pain that moves around your body. Number 4, numbness and tingling, okay? That actually can be a part of this as well. Number 5, you may have a heightened sensitivity to different things, whether it's smells and odors. Heightened sensitivity.
Mine is normally light. So you'll notice this is usually how my room is lit. And I'm trying to find a better light for while I'm streaming. You guys can see me better. But this is pretty much how my house is lit because my eyes can't take a lot of light for long periods of time. So we joke all the time that my house is literally lit like a dim lit cave. And it's because too much light it'll give me migraines and stuff because my eyes are sensitive to it.
Sensitivity to bright lights, heightened sensitivity to sounds, that can also be a part of this. Even a heightened sensitivity to medications. The next is balance problems that can be a part of this. Also, painful menstrual periods as well. Now,
who would have thought walking into a corner was going to be, a symptom of a disease they say possibly does not exist? That's wild.
keep in mind that any and all of these symptoms could be due to other conditions. So you never want to diagnose yourself. You want to talk to your doctor, but just understand that fibromyalgia can cover a wide range of symptoms.
Yes, do not diagnose yourself. It is different. Oh, damn it. Hang on a second, I did a thing. It is different to get an idea and take it to your doctor for them to look into and diagnose you with than it is, hang on, I really messed something up. It is different to get an idea and then go over to your doctor with the idea and have them look into it than to diagnose yourself. Let's not be doing that.
Five things that people just do not understand about fibromyalgia. Number one, the pain isn't just pain. It's not a headache. It's not a sore muscle. It can be everywhere. Your whole body could be hurting all at once. Number two is the fatigue.
With that number one, it can also be that it's not severe pain. It is draining pain. Where it's like, oh, it's not enough to make me not be able to go do dishes, but it's also not nothing. It's kind of just knocking at the door like, hey, just so you know, I'm still here.
And no, it's not just feeling tired. It's like your body's run out of batteries and there's just no life left in them.
You feel like you're
and
drained.
Even if you slept all night, you would wake up the next day feeling completely exhausted. Number three is the cold. The cold doesn't just make us feel cold. It heightens everything in the body.
The cold is debilitating.
You will feel stiff.
Especially if you have fibro
will ache
with
more than you've ever felt before. Today is really cold and I have 2 pairs of thermal leggings on, 2 pairs of socks, and 5 layers including 2 thermal tops, and I have still been really cold today. That is how much the cold affects us fibro warriors. Like one cold morning can wipe out your entire day. I have struggled so bad today just because it's cold. Number 4 is the brain fog. Yes, it's a real thing. It makes daily tasks seem impossible. You forget words, you lose track of what you were doing, and you tend to get muddled so easily. And number 5, after all of this, we still have to function normally. Like, we still have to fight through the pain, through the fatigue, through the brain fog, through the cold sensitivity, because life just doesn't stop. We have jobs, we have responsibilities, we have people that rely on us. So what we do is we push on through with a smile on our face. But that smile, it hides more than anyone could ever realise. So if you lived with fibro or any other invisible illness, comment I get it below so we know that we're not alone.
The next one that I'm gonna bring up, it's kind of like 3 parts. They're related, but they're not all the same thing. Which is EDS, HEDS, and hypermobility. It's hypermobility something disorder. I think it's joint disorder. And you'll probably hear it in some of these videos. And it is not just extra movement in your joints. It's extremely painful. Especially when things move back where they're supposed to be. You can pinch nerves. Yeah, it can. I have a cane and a walker for days that I just can't. And what's worse is, I hate this comment, but I get it so often of, you don't look disabled. What does that mean? What does a disabled person look like? Please tell me. Because just because I look good that day does not mean that I don't hurt like a motherfucker. It means that I have worked so good on my masking it, you just can't tell. You can't just go to the DMV and go like, hey, I'm disabled, and they'll give you a tag. No, you have to go to your doctor. If I have that tag, guess what? I have been deemed disabled. On days that I don't have a hard time walking, I don't use it. Because there's other people that need that spot, obviously. But days that I am having trouble walking, things like that, it saves me from falling in the parking lot. Because I just can't take another step. It's awful. No.
I just had somebody tell me that we don't know why people who have connective tissue disorders like EDS go on to develop histamine intolerance or mast cell activation syndrome, and why those people go on to develop POTS or dysautonomia. Beg my finest pardon. Like, we absolutely know why that happens, and I can explain it to you. Hi, if you don't know who I am, my name is Dr. Caitlin Hubbard. I have a PhD in cellular and molecular nutrition. I'm also an herbalist. There's a whole spiel. I won't bother you with it. So people with connective tissue disorders, their connective tissue isn't as stable as normal people, right? Connective tissue, I know it sounds kind of like a complex term, but it essentially just means like the tissue that sits in between cells. It actually like lines blood vessels. It lines the intestines, it lines your axons on your nerves, and it is essentially going to act as support structures, so everything...
Okay, I want to correct it a little bit. Connective tissue is essentially, it is your digestive system. It is like where your organs are. It is where your joints are. It is your muscle fibers. It is, all of it is connective tissue. And the main thing that actually put me onto this one, we always thought I was just allergic to crying, and it sounds completely dumb, okay, but I can cry any kind of tears, just cry, have a good cry. Everybody needs it once in a while. My eyes will swell shut, and it will look like somebody just decked me in both. That is not an exaggeration. It looks like I had an allergic reaction and I can't see. Which is a symptom of HEDS. It basically feels like putting lemons in your eyes. It burns to do that.
Everything kind of like stays in place, but it's also going to help maintain continuous barriers. Now, in people with connective tissue disorders, this connective tissue is like dysfunctional. It just doesn't work real well, right? It's not really strong. So it's going to break down a lot easier. Now, in places just like in the extracellular space, right? It might not even break down. It might just like flex and bend or stretch, because if you haven't noticed, people's skin when they have EDS, it's very stretchy. Now inside of this space, that's where like, mast cells live.
It's not
mast
all
cell
skin. Like right
cells
here,
that are kind of like
but like here on
alarm
my arms,
systems, And when they sense something's wrong, either chemically or physically, they're going to release histamine and prostaglandins. So in the extracellular space, if that cellular connective tissue breaks down, or if it just flexes, or if it bends or it stretches, right, these mast cells are going to think, oh no, something's wrong, and they're going to release histamine. When that happens, it's going to draw
not
more.
Quite what we're talking about. Hang on.
HEDS in 3 minutes or less. You ready? Let's go. But before we get started, my name is Alex, and I'm an osteopath who specializes in the treatment of muscle and joint pain stemming from symptomatic hypermobility, including conditions like HSD and HEDS. HEDS is a type of inheritable connective tissue disorder. This means that an individual with HEDS, their body cannot build connective tissue normally. It's built so that it's a little bit stretchier, it's more prone to injury and re-injury, and it doesn't heal as well as someone with normal connective tissue. As per the name, hypermobile Ehlers-Danlos syndrome, individuals with HEDS will typically present with hypermobile tissue. This means that their bodies can do movements which we would not see in a normal patient population because their connective tissue allows larger movements to occur. This greater propensity for uncontrolled movement can result in joint injury and in muscle injury. These are usually people who have a history of chronic muscle and joint pain. But this is where it gets complicated. On top of that, connective tissue is everywhere. It connects things. We don't just have connective tissue in our joints. We have connective tissue in our gut, in our cardiovascular system. We have it in our the ligaments that support my uterus in my body and keep it where it should be. Hopefully. We have connective tissue everywhere, and that means that the manifestation of hypermobile connective tissue can be profound because it can affect everything ranging from your eyes to your teeth to your gut, and it varies depending on individual, which...
Now when she says teeth, it's not like your teeth are going to rot out, okay? There are days I can tell when my HEDS is flared because my teeth will wiggle. Like, they'll come loose. They're not going to fall out. Nothing like that. But I can feel them in my mouth, and they'll have a little bit of a wiggle to them. And it's just because I am in an HEDS flare. And then the next day, it'll just be back to solid.
Complicates treatment and management of these symptoms even further. Unfortunately, as of right now, there is no known cure for hypermobile Ehlers-Danlos syndrome, but there are a lot of different treatment options. From my clinical perspective, it makes sense to look at things which increase the risk of injury and sensitivity to pain, so specifically looking at tissue fibrosis or scarring and inflammation. However, it's important to note that because of how unique every individual with HEDS is, they really require bespoke treatment, and a standard treatment plan that may work for a person with normal connective tissue with, for example, a shoulder injury may not work well for someone who has a very hypermobile shoulder and a history of chronic pain surrounding it. And of course, I will briefly mention the comorbidities that present alongside HEDS.
Now, part of the reason she says this is because I have to watch it when, like, I'm doing yoga, which yoga is very good for this. But when an instructor for physical therapy or for yoga will tell you to go as far as you can go, okay, a lot of the time for people with HEDS, our as far as we can go is so much further than normal people, and you don't want to keep going because then you can train that joint to pop out and go too far, if that makes sense.
Often, but I won't get into them in detail in this video because I only have 3 minutes. The word that I would use to sum up what living with HEDS feels like based on my experience with patients is disorienting. It's so confusing because everything is speaking to you all at once. You have pain signals coming from your shoulder, your knee, your neck. And you also, of course, may have some of the comorbidities, the gut issues or different neurological issues and so on. And on top of that, you can never feel quite at home in your body because your shoulder doesn't feel quite where it should be, or your ankle doesn't feel quite where it should be, or you're sitting with your friends watching a movie and you can just feel this like pulling sensation, the feeling of being injured. It's hard to describe unless you've experienced it. And I'm hoping that people are going to keep talking about this. And if you want to join the conversation, come follow me because we have so much more to say and 3 minutes is not enough.
So yeah, there's a lot that goes with it. Hypermobility, super bendy joints, double jointed in so many places. So I didn't know that this was not normal. The back of your head is not supposed to be able to touch your back. Mine always has. or your knees, when you lock your knees, they're not straight, they bend backwards. Even in your fingers, apparently, I don't know if you can see very well, but apparently this is all the more like your fingers are supposed to be able to raise. Mine goes so much farther. Yeah, there's a lot that goes with it. Like my teeth end up feeling wiggly once in a while. My hands, I can almost touch my arm with any one of my fingers. That's hypermobility. The fact that I can cluster my fingers like this. Things like that. I did not know that it was weird. Did not. And there's more to it. There's other ones that like I've done with friends of mine, and they went, how in the world? Yeah, my shoulders dislocate just from me sleeping. Not even joking. It is so stupid. So I would definitely go talk to your doctor about it. Don't diagnose yourself. And there is 3 different ones that go with hypermobility, which is, I think you heard her say it was HSD, which is hypermobility system disorder, or something close to that. EDS, which is Ehlers-Danlos syndrome, or HEDS, which is hypermobility Ehlers-Danlos syndrome. They are 3 different ones. I don't have EDS because I do not have the genetic marker for that. They are coming out with a new test for HEDS in December. And there is also one available in some places. My doctor has referred me over to Toledo, I think, to get my final test for that. Yeah, so you don't have to have all of these to have it, if that makes sense. I know one of them, it sounds like it would be a great symptom, is actually velvety skin. Okay, skin that is super, super soft, which I have. However, because it is so soft, I get unnecessary stretch marks. Like, I have them on my shoulders, from my shoulders being wide. I have some on my belly, on my hips. I got them everywhere. And it's because, without getting too big for your skin, it stretches. And too far, because, connective tissue. Like I said, not all of my skin is stretchy. Like, if you look, I can't grab any of this. But, like, on my hands, I should not be able to pull it like that. And you can have dry skin and have stretchy skin. Like, my thighs do the same thing. You can get random hives, which I get on my fingers. I'm actually messing with right now. Like, it's right there. There's a lot that goes into it. Scoliosis and joints popping in and out. Like, both my hips pop out. I don't have scoliosis, knock on wood. I do have a pelvic tilt from it. So my belly and my butt look a little bit bigger than what they are because my pelvis tilts like this. And because chest spasms, heart palpitation, it feels like my heart is a race car even when relaxing. I have an elevated heart rate just sitting here. Mine doesn't come down very often. And the only concern we have right now is that my blood pressure has been up. Heartburn, acid reflux, GERD, nausea, GI issues, increased food sensitivity, histamine triggers, rib flares, So rib flares are like, I have this one spot on my rib down here, and I've been messing with it like since I've been streaming. It just inflames and hurts. I haven't done anything to it. Nothing. I've been sitting here. No reason that it should hurt. So that would be a rib flare. Daily hives, which is, listen, I have on my finger. Dizziness when standing or reaching over your head, blood pressure spikes, seeing stars, and blackouts. So this more goes with getting POTS, but I do get blood pressure spikes, and I do get dizzy. I do not have POTS because it's not reactive from a laying down position to a standing one. Cranial instability. Okay. So that's not just like your head feels heavy. That is actually, there are muscles back here in the back of your skull that keeps your brain pushed up in that hole. Okay? Cranial instability is when that breaks down, and I don't have this, thank God. I would freak out. My mother's neighbor has this, and they're trying to figure out what to do about it. It's where basically your brain is slipping out of your skull, and it causes massive migraines, things like that. And yeah, that one is a whole trip that it could possibly happen to somebody. I know somebody it's happening to, and she's gonna have to have surgery to fix it. Mama dear. Pinched nerves, bulging discs, head feels 100 pounds, no natural C curve, not quite sure what that is. Chronic tension and pain, neuropathy across your limbs, and brain fog. Come over here and see who's looking in my window. Constant icing and bracing, tendinitis, carpal tunnel, neuropathy. I have no idea what the R word is. Basically, the point of this video is there are so many different things working against each other. Tension migraines, occipital neuralgia, I have no idea, but vertigo, pain behind the eyes, where it's not your eyes hurt, but and it's not even a pressure. It is a literal pain that feels like if you were to take an old eyeball out, you could touch it. Mood changes, constant fatigue, guilt for canceling social plans. I can't read that word because it just got too bright. Body feels like it's on fire. It's a genetic connective tissue disease with no cure.
Take a boy,
yes,
he will come and he will go.
Let's talk normal labs in Ehlers-Danlos syndrome.
Oh, sorry, hang on a second.
Patients. A lot of times what happens is patients will have a lot of symptoms. They'll go to their primary care provider, they'll do an autoimmune workup, thyroid panel, iron levels, and everything comes back normal. So they say there's nothing wrong with you. An autoimmune workup is a great idea for Ehlers-Danlos syndrome patients because there are a lot of overlapping issues with autoimmune diseases. But for the most part, it comes back normal. All labs come back normal and they diagnose them with anxiety or depression. I think the normal labs are the most important part of medical gaslighting because it leads the provider to think that there is nothing wrong because all of their tests are normal. There aren't great labs to pull for Ehlers-Danlos syndrome to prove that you have EDS because there is no genetic marker for the hypermobile type, which is mainly what I talk about on this page. So if you hear me say EDS, I'm probably talking about the hypermobile type. It also becomes overwhelming when patients bring in a lot of symptoms at one time. I've made one video on how to communicate effectively with your primary care provider, and I'm going to make one on how to get a diagnosis for chronic illness as well. An appropriate workup to rule out everything else is really important. The provider should also be familiar with some things that look like Ehlers-Danlos syndrome but aren't, like other connective tissue issues, and myopathies.
I would go over to this page if you're questioning that you have any kind of chronic illness, chronic pain, chronic disease, because she does break it down to where you're not going to overwhelm your doctor with everything you've been going through for the last 3 months. And different ways to talk to your doctor about it, so you will be able to get results. So her page is Boro Clinic, Boro Clinic, and she has a lot of good information on ways for a physician to take you seriously.
Ehlers Danlos? No, I don't think I have that, because your skin has to be, like, super stretchy, and my skin's only stretchy in, like, certain places.
Chaotic, this one's for you, with your comment. With my, I can't, because my skin's not stretchy.
I think I have that, because your skin has to be, like, super stretchy, and my skin's only stretchy in, like, certain places. Ugh, why does eating make my jaw so tired? No, I can't have sour candy. My mouth is so sensitive, it'll burn the skin right off my tongue. I want to eat nice comfort food, like chips and cotton candy. But they cut the inside of my mouth up so bad that I can't hardly enjoy them. Like, I had some salt and vinegar chips a couple of days ago, and the inside of my mouth is still raw. You know, I've had stomach issues my whole life, and I've never been able to pin down exactly what it is. I will just toggle between, like, constipation and diarrhea, and it's like my stomach is always upset, and I don't know. It also seems like I don't absorb medication properly. Like I tend to need a higher dosage than other people to have the same effect, if any at all. Oh God, is it gonna rain? I have the worst pressure headache and my knees are screaming. I don't know what is wrong with me that I heal so slowly and also so inconsistently. I just want to grow my fucking nails out, but they are so thin that, like, I literally can't. They just break on me. Like, they just chip off.
Some of these, the opposite can be true. So, like, I don't absorb medication properly. So with a lot of the medication I'm on a bunch of downers. I'm not even going to lie about that. None of them are ones that are going to get you elevated or anything like that. They're just going to make you tired. I still can't sleep. My doctor told me she cannot give me anything for my sleep issues because of all the other medication I'm on that can make you drowsy. She basically doesn't want to OD me. And make me go too far down accidentally, which could be catastrophic. But it's like it doesn't absorb the way that it needs to. Or the fingernail bit. Like, I have fake nails on right now. But usually I have no problem with growing my nails out. In fact, they grow extremely fast. Okay? I can only have these on for like maybe 5-6 days. I'm going to have to take them off because they are going to be too far away from my nail bed. And they're going to be extremely sharp and extremely strong. And I do not know why. I also have extra dead skin. I have to exfoliate like 3-4 times a week because there's so much buildup on my face. So this extreme can be one thing, and then at the same time, the other extreme can be true instead. Not at the same time, but...
Like, the layers of my nails do not want to adhere to each other. They just split.
As much as my nails are strong, they do not break. They shear off in layers, if that makes sense.
Splinter and crack off. Plus, the damn things want to grow straight into my fingers, and I get hangnails all the time, and it's a pain in the ass. No, I don't shave my bush, or do anything to it, because the skin down there is really delicate, first of all. And a lot of the hair follicles, there's actually like 2 or more hairs per follicle, so I'm really prone to ingrown hairs when I do absolutely nothing to it. So when I shave it, yeah, I'm not putting myself through that. Just the irritation from the micro fissures in my skin alone. No. Yeah, no, I can't wear glasses because my ears have the structural integrity of a thin silicone mat. Like they
Mine don't hold up either.
Putting anything on them, they fold right over, and I get the worst headache almost immediately. No, I'm fine.
I shouldn't be able to just do that.
I'm in the normal amount of pain. I just don't have the energy to like pretend like I'm not today. Yeah, not like horrible. Just like, I'm constantly sitting at like a 3 to a 5. You're looking at me with an expression of abject horror. Am I not supposed to be in pain all the time? Ehlers-Danlos?
The pain scale is what gets me all the time. And when we get to the shit talking part, I'll explain why. Because I hate that pain scale so much.
I'll be up in the club, doing whatever.
You're gonna have to watch what's up here. Because these are things that go along with it, and it's gonna go too fast for me to read every single one. Generalized joint hypermobility,
I'ma be popping that
velvety skin,
cooling and living that good
arm span difference,
let's make this last
bilateral. Those things, I always felt like they were weird. And okay, so the scales on the sides of your feet, those little bumps that you saw, I have always had those. I thought everyone did. Okay. And it just, I didn't know ever that was an EDS thing, or HEDS thing.
And we'll chill together, on and 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 on. I'ma be rocking like this. What?
Clumsiness, dislocations, subluxations, easy bruising, POTS, vascular compressions, varicose veins, osteoarthritis, flat feet, vocal cord dysfunction. So vocal cord dysfunction is when your voice is not the same day to day. Like tomorrow morning I can wake up and not have a voice. Not because I'm sick, just because my vocal cords don't want to work. It affects every single muscle range you can think of.
Yawn, want talk, what? Why don't you put it on the blog?
Dental crowding, TMJ, MCAS, Chiari malformation, don't know what that is. I don't know if I want to look it up. IBS, gastroparesis, other GI issues, tinnitus, Raynaud's, and the list keeps going.
What? Rocking like this much will be up in the club.
So yeah, that's HEDS. Which I have another one, which is spinal stenosis, but we'll do that a different day because it's already 10 o'clock and I gotta give it 5. So, we're gonna go into our shit talking part. And we're gonna start with the bad professionals. So, the thing is that the pain scale, okay? I have went to the ER because I was in that much pain and like hysterical. Okay. I let them know my pain is at a 9 out of 10 to a 10 out of 10. While I am crying, I got told that if I didn't calm down, I needed to go be removed to psych. But if I am in there and I am calm, and I make it so that I know how to mask it, and I tell them I'm a 10 out of 10 pain, you'd be hysterical right now. Those two things can't be true at the same time. I can't show up hysterical because I hurt and you're going to take me to psych. But I'm calm with a 10 out of 10. But it obviously can't be. I hate it so bad. I feel like, oh, what is that? That is not, what? No. Yeah, we're not doing political crap. Yeah, I think that if they were to listen to the pain scale, I feel like I wouldn't have such an issue with it. It's not so much I have an issue with it. I have an issue the way it's used because it's more weaponized than it is helpful.
I'm back. Tell me March has been...
What are these things? These are not supposed to be on here. What did I do to my dog?
Shut up.
There we go. Okay, so I am sorry, but if this was my doctor or nurse, I saw this thing, and if this was my doctor or nurse, I cannot Promise you that I would not be aggressive or violent. I love him too. He cracks me up.
Sit up. Sit up. I'm having you sit up.
I can't get up.
For us that have had the medical gaslighting or shitty professionals that we've had to deal with, some of these are going to be triggering. Just a heads up. So if you feel like you're going to be easily triggered today, it's probably where you want to end it, because both sets are probably going to be at least trigger you a little bit.
This morning, this emergency room doctor banned from working in this Northern California hospital.
Los Gatos.
If I could get up off this chair, I really would. But
Yeah,
I can't.
you really should, because
I'm so glad that she's banned.
I can't, and you're not going to keep tugging.
I don't understand what this doctor is frustrated with. Everyone can have a bad day, but when you're taking it out on someone who's ill, that's like the worst form of it.
I just tried to inhale, and I even told her I could not inhale.
He can't inhale. Wow, he must be dead. Are you dead, sir?
I have had doctors like this one, where instead of trying to help you, they want to make fun of you and make you feel bad for going in. If you are concerned, especially as far as this man is gone, because he can't even sit up. If you are concerned about your health, go get it checked. Don't let a doctor or even a family member ridicule you into not getting it checked.
I don't understand. You are breathing just fine.
What the doctor is doing is totally unprofessional. It's not necessarily medically wrong, because he's clearly breathing fine in terms of whether or not he's stable. But when you're mocking someone and they're telling you they're having difficulty inhaling, you need to be able to function professionally here.
They gave him fluids and they gave him something, a pill. I don't know what they gave him. Yeah.
For what?
For his pain and for the anxiety.
So you need narcotics? Is that what you need?
I'm gonna go off camera,
The one thing
but I'm
that
still
is
here.
important for patients to know, when you come in and you say, I need pain medication anxiety, not all doctors are gonna be receptive to this. Can you imagine if a patient comes in and says, I need pain medication anxiety medication when they're experiencing something like collapsing during a basketball game, and I say, oh, okay, I wanna make sure I do the right thing that you ask, and I give it to them, and they were having a heart attack the whole time that was never ruled out, and then they end up dying. That's totally my fault. So there's a layer of, this isn't a gas station or a 7-Eleven where you can just go in and order what you'd like. But at the same time, the doctor should be receptive if the patient's explaining what worked well in the past, what does this feel similar to, and then rule things out.
In my mind, I don't think she should be practicing medicine at all, because if it's not a race thing and she treats everybody that way, then that's a problem.
It's very...
I think he has a fine claim. I like the way that he put that. As to, I don't know if it was me because I am a different race, or if it's just she's just this way with everybody. He admits that part, and he admits that it could be race, it could not be. It could just be she had a bad day, took it out on her patients, which is not okay at all. But I think that he was in every right to, make the question at least. And he even admitted it may not be.
Difficult to know whether or not this is a race thing from the limited footage. Obviously, I don't blame the patients for saying that given the circumstances. But, doctors can be fined. Doctors...
Yes and no. In the hospital, you can request a new doctor or nurse. It depends on how big of a hospital, doctors available, or sometimes and I've had this one happen, because I'm in a smaller region and not near a city, where I had a doctor that, in my opinion, was treating me like crap. And he basically told me that hypermobility does not exist. And if I was in that much pain, I wouldn't be walking on my foot. You don't know how much pain I can take. I'm sorry, sir. I have been stabbed in the foot and still walked fine. I walked 3 hours after a C-section. You don't know the pain I can take. So at least check it out before you completely dismiss me. Anyway, I asked for another doctor. Our ER said, fine, that's okay. And then made me wait, and made me wait, and made me wait. And I couldn't figure out what was going on. So I went and I hit the call button. Nurse came in. I asked her, what's going on? Is a new doctor going to come in? And she had told me, hang on, baby, hang on. She had told me that since I wanted a different doctor, I had to wait for a shift change. So I was stuck in the ER if I wanted to be seen for the new doctor to come on staff. Hang on a second.
Can be suspended. They can lose their license for a period of time. They can do work to regain their ability to practice. Just stripping someone of their license every time they do something wrong is not good, because then doctors don't feel protected. And sometimes that can come at the cost of them practicing well, and also at the cost of their mental health. It shouldn't be something that should be taken away off of a single incident. Repeated incidents that are not improving with reprimands and suspensions, etc., obviously, yes.
Sit up.
Now, I have a feeling, one, yes, I do believe that he's right. She should have been written up multiple times, but we don't know that she wasn't. This could have just been the final straw. And it was like the last notch in that belt before she's, her license is taken away. Either one can be true. We don't know the backstory of that part.
So I called the...
This one was extremely hard to watch, because I have sat there in this state and felt so alone and made to feel like I was such a bad person only because I wanted to be taken seriously. I wanted just for someone to look at it. But I got dismissed so hard and then made to feel bad about my concerns. And it is so defeating and so soul-crushing. I am 37 years old. I didn't get diagnosed with anything until I was about 32, 33 years old. I have had this pain at least since I was a teenager. It's gotten worse, obviously, over time. But to anybody who has felt the way that this girl is, and especially in her car, because you feel embarrassed for breaking down like this. You do. I think she's very brave for putting it out there that this happened. Because on top of that, doctors will tell you, like any other doctor is going to tell you this, go get a second opinion, and a third, and a fourth, until you feel like you are being heard, until you feel like you are taken seriously. Keep looking. There are decent doctors out there that will listen. Case in point, my doctor is actually someone I went to high school with. She is amazing. I didn't like her in high school. I thought she was a raging bitch. I even told her so straight to her face. My doctor, I completely love her. She is the first one to listen to me about being in pain. She's the first one to not call me crazy or just fat or try to give me something for anxiety instead of something that is going to help my body either heal or cope with the pain. They are out there.
Clinic afterwards, and I told them some doctors should not be able to perform in the medical.
And this is what I meant about, if you are a shitty person, do not go into a profession of caring. If you are a CPS worker, if you are a judge, if you are a police officer, if you are a doctor, if you are a nurse, if you are honestly a shitty person who doesn't think that you can be wrong, don't take the profession. Go be a lawyer where you can be shitty to people all day. Okay? Go, I don't know, do something where you can just be nasty all the time.
Field. I have never complained about a doctor up until today. I also have never been treated the way that I was treated today. I had anticipated this appointment with this doctor ever since I had to get it scheduled. I got the referral to go and see him because I thought that I was going to figure out what was wrong with me. But I got treated so badly today. The man was rude coming into the room anyways, and I just wanted to stop him before he even got started and just tell him, like, hey dude, look, I done been through enough. You don't know me. You don't know what I've been through lately. And like, I wanted to just walk out.
I am going to tell you, if you are getting these feelings from a doctor prior to like their actual conclusion, just walk out. You're going to save yourself a lot of hurt doing it. Leave that one. Go to a new one.
The way he made me feel was just so terrible, and I don't understand why doctors are allowed to do that to patients. Like, you're there to try to feel better. The way he talked to me and the way he treated me, I feel like such a terrible person. So, some things that he said to me while I was there was, do you work? And I said, what? I do what I can as far as work goes. I have very low potassium, so I can't like work outside in the heat or anything, because sweating, you're losing potassium. The reason why I'm there to begin with is to figure out why my potassium's always so low. I said, but me and my fiance, we flip houses, and I do the interior design part of it. And he said, okay, well, what kind of insurance do you have? He said, do you, you've had a lot of tests done, I could see, so you've had like thousands of dollars of tests done. So what kind of insurance do you have? He said, do you have insurance through your work? And I said, no, sir, I pay out of pocket. And before I could say for my insurance, he said, you paid for all of these tests out of pocket. I said, no, sir, I pay out of pocket for my insurance every month. Oh, so you have Obamacare? And I said, I don't know. I have United Healthcare. And he was like, yeah, did you not apply for it on your phone? I said, I applied for it on my phone, yes, through the marketplace. You have Obamacare. And I said, I don't know. I don't know if it's Obamacare. I don't know what the fuck it is. All I know is that I'm sick and that I need health insurance, so I pay for it every month out of my pocket. I don't give a fuck what kind it is. And then, I'm sorry. I'm just getting way too upset. He tells me he doesn't understand why I'm at his office. We're going over like everything. He says, do you not have a binder with all of your health stuff in it that you should bring to someone like me? I said, sir, you're a kidney doctor. I sent you a year's worth of my potassium and my urinalysis. I said, in my most recent 24-hour urine, my aldosterone, renin, like, I just had all those done. I sent those to him. He just didn't want to look through the papers. I didn't know that I needed to bring a binder. And he said, oh yeah, most definitely. Someone who's had as much testing and work as you've had, you need to be better prepared and have a binder with you.
I'm sorry. I am very sorry. There are things like my chart for a reason. This was not one that was made a while ago. Okay? This story was posted 9/3 of 2025. If there's something that I need my doctor to see, I'm going to set it ahead of time. If they decide not to look at it, why are you not doing your job? I don't care if you look at it during my appointment. Okay? I'm just throwing that out there. To sit there and say that she is not prepared because she didn't bring it to the appointment with her. What is the difference? Please tell me. what the difference is between her bringing a binder and him pulling up that information in his system that she sent over.
And I said, sir, with all due respect, I do have a binder, but unfortunately that binder burned up in my house 5 days ago. And I just haven't been able to go through and reprint new pages and make a new binder for you. I'm very sorry. And then we were going through like my family history of stuff, and I told him how my daughter has kidney stones and how she was supposed to get a stamp put in to pass one of her stones. And whenever it came time for, first off, he told me I needed to go to the Mayo Clinic instead of his office because my low potassium is a mystery that he's not willing to figure out, and that I need to go to the Mayo Clinic. But when I asked for the genetic testing that I was told that I needed, he told me the one that needs genetic testing is your daughter. What kind of parent are you? You haven't gotten your daughter genetic testing. She's the one who had kidney stones so bad that she was gonna need a stent put in. And I was like, sir, I didn't know.
If her daughter's doctor did not bring up any kind of genetic testing, how is she supposed to know to go take her to do that? Her doctor told her. This one honestly pisses me off. Questioning her about her kids and what she hasn't done isn't okay, especially when it's weaponized like this. Like, he just wants her out of his office because he doesn't want to deal with a hard question.
Nobody ever mentioned to me that my daughter would need genetic testing for kidney stones. I would have never thought that. So he made me feel like such a shitty parent. And then he told me that there's no way that I can have the genetic disorder because I'm not in acidosis or something. So when I left, I looked it up. If you look here, it says tubular disorders without acidosis. And this is what I was supposed to get checked for. Gentlemen. And it says no acidosis. Barter syndrome, no acidosis. Little syndrome, no acidosis. But do you see how it's all low potassium? Low magnesium, low potassium, that's what I suffer from. If you look right here, it says bottom line is some renal tubular disorders cause alkalosis instead of acidosis. I know some doctors are just bad, but because I didn't have high blood pressure, he says that my kidneys are fine. I was just in the ER last night with a lot of heart palpitations. I've been having heart palpitations for the last 5 days.
See, and that's what I mean by, like, you feel just devastated. I really hope that she ended up turning him in.
I don't believe there are any bad doctors, okay?
Okay, this is actually a documentary done, and I guess it's called Skin Deep. I'm not sure what platform it is on, but this scene right here floored me for a documentary.
I have never went one. Everybody in my medical school class was awesome. By the way, do you know what they call the one who graduated last in my medical school class? Doctor, exactly right. But they were all really great folks.
And this is one form of a doctor gaslighting.
All of them were really super bright, caring individuals. Everybody I've met in my department is super great. So I don't believe there's any bad doctors.
Sorry to interrupt. I was totally covered in lesions. My whole front of my legs were covered. They were oozing. I went to the family dermatologist. He never took blood. He did not take a culture. He only looked at me and he diagnosed me DOP, put me on antipsychotic, whatever those drugs are. And you're telling me, is this a good doctor?
Yes, I'm telling you, that's a good doctor.
Misdiagnosed me with this disease?
You had a terrible experience with him, but it wouldn't surprise me if you're the one, you know, and most of the time he probably did.
You notice he says, and you're the one, and he stopped. Which honestly tells me everything I need to know about him as a professional. She can say that he's a bad doctor. She had a bad experience with him. Does it mean that he treats all his patients that way? No, it does not. But, there's the but. The fact that he wouldn't look into it and gave her this minimal diagnosis and said she's crazy for the rest, that is a bad doctor.
Okay.
Their responsibility
That's
to
it.
treat their patient. To treat the patient, to diagnose the patient, to look at the patient. That's your responsibility. Not to make sure I have a good time. It's your job to look at me, to listen to me, to look at my history, and to make a rational decision. You don't jump from, hey, she's got a little spots on her, to, here, take a freaking happy pill. That's what you do, and you shouldn't be in medicine, Bubba.
She's not wrong.
You just reminded me that there was also a chocolate cyst on the left ovary. So what happened was I got the ultrasound after following the CT scan with contrast, and I was feeling more pain on the left side, as I've shared.
Now, I will say this. I refuse anymore to go see a doctor that is a male for a woman's issue. I'm sorry. Do I think all male doctors just completely skip over it? No. But because I have had so many that won't listen because they don't understand women and the woman anatomy and that it is different from men, I won't. I refuse. If I'm getting a pap smear, I'm going to see a female doctor. If I'm having period trouble, I'm going to see a female doctor. If my doctor is not a female doctor, I'm going to go find a second doctor for those
when
issues.
the tech was actually scanning there, I specifically asked her if that was where the thing was, and she was like, yes. And when I looked at the results of the ultrasound, I saw that the radiologist hadn't noted anything on the left side there. So I asked for a review. Only one radiologist had looked at the scan rather than two. And then they said that there was a small chocolate cyst there. And I was told that they would like update the notes on that ultrasound to reflect that there is, because that indicates endometriosis, I guess. But they haven't done that. So can we add the chocolate cyst to like the overall health history?
I am not, I don't know if you can identify a chocolate cyst on imaging alone.
That's what they said.
Who, the tech told you that, or the radiologist?
The radiologist, but the doctor, who was an ND, told me that after I requested that it be looked at again, she spoke directly with the radiologist and was told that. See, that's what I'm, like, I don't want this to fall through the cracks because they didn't update the notes.
And so you're saying there was also a finding on the left?
I'll be right back. I gotta pee. Go ahead and listen to this.
And you spoke with the radiologist?
I tried, I called and was on hold for 25 minutes and nobody picked up, so I asked the ND to connect with them, and she then called the radiologist. That's what she told me. She told me she spoke with the radiologist.
So Dr. Gabber, I met with Rachel today. She recently had an ultrasound.
It's January 8th, I think.
Her impression is that there was you said chocolate cyst?
Yeah, but I mean, phrasing it that way makes it sound like the ND told me that it was there. My last PCP told me that it was there after a conversation with the radiologist. So hopefully they remember that.
Okay. So chocolate cyst seen on the ultrasound.
It's very small, but yeah.
On the ultrasound. But we don't currently see that in the report.
Could you note that this is what my last PCP told me was there, rather than that it's just my impression? I don't want it to get dismissed because it's believed to be subjective.
You're saying, but your PCP read the ultrasound themselves?
They told me that they called the radiologist to check in because I had asked that it be reviewed because it seemed strange to me that nothing was showing on the left side because that's where the pain was. And that's where...
Prior PCP.
Yeah.
Her prior PCP spoke with you.
Yeah, thank you. Since it's endometriosis and that grows, could you note that the last PCP told me the report would be amended, but it hasn't been yet?
Well, first I want them to take a look just to confirm if it's there. And then if it's there, we should amend the report.
But it's there.
You're
Why
fine.
would they tell me that? I'm sorry if I seem intense, but like this entire American medical system experience just seems to dictate that hypervigilance is necessary.
Well, basically what I'm doing is I'm messaging them, asking them to take another look at the ultrasound, asking if they see this.
Mm-hmm.
If they do see this, then we should amend the report.
Yes, but I was already told that they see it and that the report would be amended. So even if you think I'm inaccurate, could you at least let them know that I was told by the last PCP that the report would be amended because this was there and it hasn't been amended yet. And then they can confirm if it's there and so forth.
The important thing is it there or is it not?
But I was told it was there. Why is it?
So, this argument doesn't even need to happen, in all honesty. Not so much on her part. She's trying to make sure he puts 2 phrases in the email. That my previous primary care provider said this was on there. Double check because I was told it would be updated and it hasn't been. I understand he's trying to say that, look, I'm asking them to look, but you're not putting in there what she wants you to put in there. And these are things why a lot of people they don't end up feeling heard. Is
this doctor?
You're not telling her that you're putting the actual phrases.
She said this out loud to a patient. Is this real?
Why will have healthy person chest?
Yeah. It does worry me a lot, though, whenever I feel it, just because it's on the left.
So she's talking about she has pain on her left side in her chest. And what he's telling her is that you shouldn't worry about the chest pain. It's nothing because you are too young to have disease. You shouldn't worry about it. It's just from stress. And you should go focus on making money. So not only completely, you go into the ER and you tell them you have chest pain, you're going to go get an EKG. Sorry, you are. You're going to get the little stickers and be uncomfortable. They're going to make sure you're not having a heart attack. It doesn't matter your age. That's what they're going to do. But this doctor is saying that her being young, she can't have a disease.
Inside, but
that's your problem.
Yeah.
And that's why they diagnosed you ADHD and all that, right? And because who gets ADHD diagnosis? This kind of hyperactive all thing.
So when it comes to the chest pain, though, is there a time where I should be alarmed? Like if I feel tightness or pain, like
in fact, chest pain, nobody will give in your age any value to it. Young people don't have disease.
Okay.
And if you have disease, it gets diagnosed in 2 minutes.
So this bothers me for a couple reasons. Like I said, I've been trying to get diagnosed for at least 20 years, right? And 2, I am currently fighting for disability because of what this man is saying. My doctor has written to the disability board that no, I cannot work. I can't sit for too long. Things like that. I can't stand for too long. Even FMLA time that I would need to take, it would run over. Those kinds of things. And basically, so far, I have gotten denied by disability because I am only in my 30s. I should not be this broken. So, the things that he's telling her, it bothered me very badly.
Thinking all negative, these are also considered weakness.
Yeah.
Look up more like how I can earn money, 100,000 was.
So a woman reportedly talking about left-sided chest pain that she's concerned about. The doctor responds, young people don't have disease. That's hyperactive thinking. She's reporting concern with cardiac symptoms. And when she says, but when should I be alarmed? His answers, they get worse. No one will value this because of your age. You're thinking, it's all negative. This is weakness. Then, and here's where I lost it. He tells her, think about making money instead of her health. A patient with years of chest pain, and the doctor tells her to focus on making money. Was he a life coach? Here's why this is potentially deadly. He's not just dismissing her symptoms, he's teaching her that seeking care is wrong, that symptoms are just negative thinking, that worrying about health at her young age, that's a character flaw. To every woman watching, your health is not negative thinking. Seeking care when you have symptoms isn't weakness. You can demand tests. Don't accept dismissal. Your instinct could save your life. This doctor...
Fighting with disability is the absolute worst part of everything, I swear, because there's nothing to help it. There isn't. Thankfully, I do have a doctor that basically I go see her with any pain issue that I have, and she reports it to my lawyer so he can send it over to disability. Thankfully, the job that I got where basically my spine compressed too much, so my nerves in my lower back are now constantly pinched. They had a program where I have a lawyer, and I continue to have a lawyer. I have been fighting this for over 3 years now. And what they're coming back with is that, well, you can still do stuff. You can go get a part-time. I can't go get a part-time job because there are days I can't walk. There are days I have to use a walker. There are days I have to use a cane. There are days I need nothing at all. But those are so few and far in between. It astounds me.
You're gonna force me to put my kid on...
This one made me mad because it is always the parent's option to medicate for a non-lethal disability. Make sure you watch how I worded that. A non-lethal or life-ending problem. It is always, always your choice to do medication or therapies or both. What we did with my kids is we tried the therapies first. If they needed that little bump up, then we went to medication. In no way or form is what you're about to watch okay.
ADHD medicine, or else you're going to call CPS on me?
Be real. I never said
over ADHD medication.
This is what's recommended for your kid. You have to put your kid on these meds. Like, it's best for your kid. I'm trying to do you a favor. Not even do you a favor, do what's best for your child. And if you don't follow these instructions now, I will be forced to call CPS.
So you are forcing me. You're saying either I put my kid on medication that they don't need.
I will be forced to call CPS. What you're doing right now is jeopardizing your kid, jeopardizing your kid's future. I'm not trying to sit here and argue.
Now, look at this nurse. He can't even believe what's coming out of that doctor's mouth.
With you, I'm not debating with you. I'm the doctor, so I'm telling you what's best for you and your kid.
But I don't understand because my child has not shown any symptoms of ADHD, and I'm asking if I can get a second opinion, and you're telling me no, either put my child on medication or you're calling CPS. Okay, that's forcing me.
You asked about a second opinion. I am your second opinion. I'm the doctor.
No, you're not. You are the first opinion.
Okay. All right. Well, first and second. Why? I'm your doctor. If you don't trust your doctor...
No, you can always go get a second opinion. Always. And what he said is absolutely wrong. If you don't feel that your child has had symptoms to anything, and you don't agree with the diagnosis, you can go somewhere else and get a second opinion. What he is trying to do is wrong. You cannot do
You
this.
shouldn't be, coming here. Which is crazy for you to think that.
I would be
If
removing
I trusted
myself.
my doctor wouldn't be threatening me with calling CPS. That would be me trusting my doctor.
Like I said, it's not a threat. It's not a threat. I'm trying to do what's best for you and your kid. If you love your kid enough, then you will
I would be removing myself from that practice.
listen to my words.
Don't tell me if I love my kid or not. That's my kid. That's my kid.
I understand that's your kid, but understand that I'm the doctor. I'm doing what's best for your kid. I'm literally showing you the results. I'm giving you the best advice. Put your kid on these medications because it's best for them. If not, by law, I am forced to call CPS because you're showing signs that you don't love your kid enough to actually put your kid on these medications.
That's right.
I have never heard of this. We came here for a checkup. Their teachers have never, ever asked me to get them tested for ADHD. So this is a surprise to me, which is why I asked for a second opinion. And now you're just threatening to call CPS on me. That doesn't make any sense.
Fine, but look at how you're acting. Look at how you're acting. That's why, of course, your teacher's not going to tell you that your kid is. These kids run around all day and they play and they're hyper and they do what they do, correct?
Right, so my kid's a normal kid. You know what? Call CPS. Call CPS. They're going to see my clean, loving home. Call them. I don't care. I'm out. You're going to force me.
Worst doctor I've ever worked with? Story time.
This one's
in the
coming from a
ER,
nurse.
Working with a physician that could piss off the Pope. She was just so crude and didn't have the skills to back up her bad attitude. Patient in one of my rooms had a fractured humerus, a crushed elbow, and fractures of the posterior tibia and fibula. It crushed his arm. Some people would say a town drunk. He drank every day and was a frequent patient to the ER. He was requesting pain medication very loudly. Everyone in the ER could hear him. I came to the doctor. What are we going to give him for pain? And she said, it appears to me that he has already medicated himself. I said, what are you talking about? And she said, he's drunk. I looked at his chart. His blood alcohol level was legally drunk, but not really for him. This was his norm. This when we were doing paper charting. I looked at the record in about 10 minutes and nothing was written. I said to her, you didn't write anything for pain. She said, I told you, he's self-medicated. In the nurse's portion, I put patient request pain medicine.
I do understand why the doctor is concerned about prescribing anything for pain. However, and it may take longer to get them to him because they have to calculate things up because he has alcohol in his system. Like you heard her say, he crushed his arm. Okay. It doesn't mean that you let somebody sit there and suffer. And she said he wasn't overly drunk. He was legally drunk. Okay. For alcoholics, that's not honestly much. But there are certain things that you can do as a doctor as to, okay, this is what his blood alcohol is, so we can't give him this much or this medication, but we can give him this. Like, there's alternatives to that stuff.
Be notified, no orders received. 10 minutes later, same thing. I was waiting on the OR team. It was going to take 2 or 3 hours to get some piece of equipment they were waiting on for his arm. I said, we need to give this fella something for pain. Again, no orders. A third time, same thing. Told her, no orders. The fourth time I came, she got the chart out of my hand, looked at it, and she said, you've charted this 3 times? I said, I'm getting ready to chart it the 4th time. He needs something for pain. And she quit documenting that. Let me explain.
That bothers me. As a nurse, you document everything. You document what the doctor is giving, what they're not giving, what you asked for the patient, what their decision was. You document everything. 1, that saves your ass. 2, it holds the doctor accountable for anything crappy that they're doing like this one.
To you how this works. The patient tells me he's in pain. I tell you, you decide what to do. The patient tells me he's in pain. I tell you, you decide how to treat the pain. If you feel confident you are making an appropriate decision, then there is no problem with me charting the patient requesting pain medication. She steps a little closer to me with an aggressive body language. Says, quit documenting that. And I said, I will not, but I will tell you what I will do. I will pray that someday you need someone to show you some compassion and some caring and some love, and that you are treated in equal measure to how you have treated this man. We were almost nose to nose. She was so angry. And she said, there will be repercussions for this. I said to her, the only thing between you and I right now is air and opportunity. Your move. As soon as the ORT walked in, he said, please knock me out. I'm dying here. I've been begging for something for pain. The orthopedic surgeon said, y'all haven't treated his pain? Okay. Yeah. Well, I'm glad she heard that. Worst doctor I've ever worked with?
So, part of the reason that I'm doing this is also because I get a cold as a cold. But like with me, it sends everything that I deal with into a flare and a spiral. And it'll take me like a month to actually get over it. Like fully over it. And on top of that, I am so tired of the you don't look like you're hurting. If you want me to hear your side of stuff, then you gotta calm down, even though I'm crying because I hurt. We're being accused of medicine seeking. Things like that. And I know I don't look disabled, quote unquote. But I get, what is that even? And I was guilty of it. Before I got this bad, I was very guilty of it, of I hurt and I still go to work, or I hurt, and they don't look like they have anything. You know, why, how come I can't tell that you're disabled? Once I started getting my diagnoses and I started getting so much worse, it is astounding how uneducated about it I was. And it's pretty much just don't assume of people. Right? Like, I've made mistakes in my past, and I'm honestly saying this to people that were like I was. As to, you need to be educated on it. And I feel like people don't know unless you can honestly lay it out for them, or you go through it.
But this is probably the last thing that I would use as a defense to defend my client.
This one is fucked.
Coup de grace, Your Honor. We have a video.
Background. This POS right here. Okay. He is from Miami, and he is accused of sexually assaulting a patient, which was recorded on her phone. So basically, he gave her a calm down pill and started giving her the gas. And when she was given the gas, it fell off of her lap, screen down, camera up, so it caught everything. And while she is dopey, he is saying it was consensual because she said okay while on the calm down medicine and the gas. I'm sorry, what? That is not consensual. I don't care if she said yes. I don't care. I don't care. That is not consensual. If there is such a thing as DR, where you have too much booze or somebody puts something in your booze and you go along with it at the time but you can't remember the next day, if that is a thing, this is not a thing to be consensual.
Of the incident, clearly, not even any question, that this was a consensual encounter.
Yeah, I don't think somebody that is on anesthesia can say that this is consensual.
This patient goes to the doctor to get some medical procedures done in her face, and she wants to document it.
Which is a good thing that she did.
So she starts documenting, okay, I'm getting injections in my face, I'm getting this, I'm getting that. And through this process, she is recording it.
Because had she have not done that, the doctor would still be free. She would be a victim, and nobody would ever be able to defend her.
But she's also taking a gas which makes her calm down. She had also taken a pill to calm down.
And if you've ever been on anesthesia or you've ever taken a pill that calms your nerves, you know how much it puts you in a relaxed, calm state.
When she decides to record herself in one of those instances, she passes out. The phone falls, and it falls right next to her lap. It falls with the screen facing down, the camera facing up. So it's capturing everything.
And this is why I could never be a fucking attorney, because the moment somebody comes into my office saying, hey, I need you to represent me because I did something fucking horrible, absolutely not. I'm quitting my fucking job, losing my license, and turning your ass in. And to the
Breaking news, these nurses in California were just fired after posting a TikTok making fun of their patients at their OBGYN. So this person right here, she's the ringleader of this. It was actually on her TikTok account. She had all of her nurses pose around a picture and said, "Are patients allowed to leave you guys gifts?" To which then she posted pictures of her fellow nurses posing with what people are saying is bodily fluid from their patients on the sheet here at their OBGYN. And these are the gifts that they said that their patients are leaving them. We love our gifts so much, and they're making fun of the bodily fluid that these people ended up leaving on there because they're at a doctor's office. This woman here even stuck her tongue out and got her face right beside it. She said all shapes and sizes. And then you had all of them post together and say, make sure to leave your healthcare workers sweet gifts like these. And after that video went...
I'm sorry, it's gross.
Ooh, this is hard to watch. Be forewarned.
I'm not being hostile. I'm just trying to explain to you, but I'm also. But you need to also
This
help
is
us help
this
you
one's
too.
bad.
I mean, there's nothing else she can do.
I don't understand what I should be doing.
There's nothing else she can do.
There is.
What? Tell me what I'm
trying
supposed
to focus on your breathing.
I'm trying,
She
and I'm
is breathing. She's at a 10 out of 10 pain. I
Okay,
don't.
well, I just know that she's gotten even more hysterical since you've been here.
You're gonna drop more guards, okay, when your support system is there because there's someone to help back you. I never used to be that way, but I actually have, a decent husband now that he does back me. And when that person is your safe spot, you are going to be able to let yourself go more. Now, one of the important details of this that's in the description is while this, I don't know if it's a doctor or a nurse, is talking to her this way, she has the pain medication to give her that the doctor ordered her in her hand and refuses to give it to her until she quits. Which is...
Are you saying I can't have my advocate?
If it causes you to behave this way, it may limit your advocate, yeah.
What? How am I behaving? How is my behavior?
What?
A woman is in 10 out of 10 pain, and the nurse withholding her medication. She won't give it to her. Why? Because she needs to calm down and focus on breathing. Oh yeah, and stop crying. So here's the backwards logic. She's crying because she's in pain, but the nurse won't give her pain meds until she stops crying. Then her husband tries to advocate for her, and the nurse calls her even more hysterical. Hysterical, a word used to describe women's pain for centuries. So here's what's happening. The nurse is using pain medication as leverage. Comply, honey. Stop crying. Then you...
And this is why people like me, or even like people like Chaotic, when you go in for pain, we end up masking it so well is because this happens. And it happens a lot.
You are about to be intubated, sedated, paralyzed, completely vulnerable. And your nurse decides that this is the moment to mock your strong political views on TikTok. According to CBS 12, Stephanie Kruger, a nurse from Tampa who worked with cross-country healthcare, posted a video questioning why patients would voice strong political opinions right before anesthesia. She pointed out the irony of patients expressing serious views while about to be paralyzed for surgery. So let me be very clear from a nursing perspective. When a patient is under anesthesia, they are at their most vulnerable state. They cannot advocate for themselves. They cannot protect themselves. They are placing absolute trust in that surgical team. So this is not about whether you agree with a patient's politics. It is about professional boundaries and patient safety. And we also need to have a bigger conversation on this. There is a difference between educating online and exploiting clinical moments for attention. And too many healthcare professionals are confusing the two. Clinical spaces are not content studios. Patients are not engagement tools. Our licenses do not pause when we log in. If a nurse's personal bias shows up in the OR, that is not just a social media problem, that is a safety problem. Florida Attorney General James Meyer responded, calling the remarks vile and stating that medical professionals who compromise patient safety based on political views will not be tolerated.
Now, I don't know if this is where a nurse saw a video of her patient and then went live in the OR, or did a, video in the OR, which is unacceptable, or if the patient stated her political viewpoints before undergoing surgery with this surgical team. I'm sorry, if I see somebody going into an app like TikTok right while I'm getting ready to be sedated, I'm sorry, I'm not getting surgery that day, for one. For two. And this is just the facts of the world that we live in. I ain't along about anybody. I don't like either party. In all honesty, I think they work together to keep everybody divided. And so that we're mad at them, or so that, we're mad with each other and not them. I think that's the whole gameplay. And that's my complete opinion. However, stating that opinion when you are about to be this vulnerable is dangerous. There are psychos everywhere. And if you state, oh, I'm a liberal, or I'm a MAGA, or, I'm a Democratic, or I am Republican, stating those when you're going to be that vulnerable, there are people that will, end you over that. I would like to think they wouldn't get into the medical industry. But, the world we live in anymore, it's just a bad game to play.
2 nurses lost their jobs after their social media posts went viral. This is a follow-up to the video I posted yesterday. So here's the skinny. First, Lexi Lawler, a labor and delivery nurse out of Boca Raton, Florida, made a TikTok post wishing Press Secretary Carolyn Leavitt a 4th-degree tear during pregnancy and hoping she rips from bow to stern. Second was Eric Martindale. While somewhat less graphic, in a Facebook post he stated that he would refuse care to Republican patients. The post was deleted and he later claimed that his account was hacked. Both instances appear to have been on personal accounts after work hours, so not actively recording or creating anything during work. This is a vivid reminder that social media platforms are in essence a public forum, and anything that you say or do can and will be recorded. Now, do you agree the punishments they received were just? Or is this overreach because they were on personal accounts off duty?
This one's a bit touchy. I think they at least should have had to go with leave with a write-up and a ding on their license. Maybe not completely fired. However, it is very problematic when you are wishing a medical mishap during a woman's pregnancy that could affect her the rest of her life. And then, two, to say that you would do something to your patients if their viewpoints were a certain way. Those are very problematic things. Yeah, it's a very, very gray area.
A white nurse amputated a man's
me up.
leg in the nursing home.
Listen very closely to what she says. At first, I didn't think it was a big issue. No, it's a big issue.
I don't think you heard me. A white nurse amputated a patient's leg in the nursing home with bandage scissors.
I don't know why we had to emphasis on race. But, yeah, thankfully she had said that at least the big emphasis was on nurse and not doctor.
The patient was diabetic, but also on hospice. The nurse said the tissue was necrotic, and she felt since the leg was barely holding on by 2 tendons, she was just going to go ahead and cut it off. I said, without a doctor's order, without consulting with hospice, she decided, as the nurse, she was going to go ahead and amputate his leg. 2 CNAs stood by and actually assisted her.
No, ma'am.
And then they tell the administrator what just happens, and she says, don't tell the DON. And then the nurse with the CNAs, along with the administrator, they take the leg and they store it in the basement. Another nurse caught wind of what was going on and called the state.
Good on them for calling the state, but can you imagine going through stuff in the basement and just coming upon this leg, random ass leg? Like, that'd be a bad day.
My ick is when you come in for.
Okay, so this is problematic because they are at their nurse's station and other people can hear them. I don't think this kind of stuff should be, I don't know, like, done at work. Like, maybe get your friends together after work. Some of these, yeah, they'd give me the ick too. But to say them at work.
Your induction, talking about, can I take a shower and eat? What?
If they are a first-time mom, okay, and you have to be induced, they aren't going to know that they can't shower and eat beforehand. Like, there's really no point in showering beforehand because you're going to get all kinds of nasty. I'm just saying. The eating, you can't have food because labor is tough and it can make you throw up, and that creates a bunch of other problems.
My ick is when you ask me how much the baby weighs, and it's still in your hands.
Are they aware though? Like, I would hope to. The ick for me is them doing this there at the nurse's station. Because what if there's a patient, like, right there? And two, like I said with this one, when you have a baby come out, so much has already gone on. Like, I wonder if any of these nurses have had a baby. Because you're so disoriented. Of course you're going to want to know what the baby weighs. And I understand that, well, the baby hasn't left you. I get it. But the mom's not in her right mind.
Dad comes outside and asks for a paternity test. right outside the room door.
Saying you don't want any pain medicine, no epidural, but you are at an 8 out of 10 pain, just a Cervidil, and you're still...
Okay, that one, I don't like it. A lot of women want as little medication as possible. I don't care if she's screaming in pain. That's her decision.
Still closed, fingertip.
When we've already told you to push the call light, but every 5 minutes, your family member coming at the front desk,
Can I have some water?
asking for something else.
Excuse me, can I have a blanket?
Another ick. When you're going room to room between one baby mama and your other baby mama.
Oh. If that is actually what is going on, that would honestly, yes, give me the ick. But how do you know it's not like the instance that we had with my two nieces? They ended up in labor at the same time, same hospital, right next door to each other. If my brother were to go in and see my niece over on the right and then come out and go over on the left, would you think that's the baby daddy? Like, I get it, but is it an actual baby daddy, or are you assuming? Because that would be problematic.
It's the unlimited trips to the nurse's station for me.
My ick.
There are some that do abuse the nurse's station. There are others that will... I get that you're busy, so you're not watching the call light, and I've pressed it like 45 minutes ago. Can I get this thing? So it could either be an overreaction or a legit thing. But again, probably don't do it at the nurse's station. And then we're going to go on to patients.
You want to say that again?
This is a problematic patient. This woman, standing right here, has so much patience. I have not found anything wrong with what she says. She tries to explain but keeps getting cut off.
No, I'm not going to repeat myself. But you are discharged from the hospital. I would like to see in my medical form where you treated me for this issue. I've explained what I'm talking. I'm going to step away. Nope. Required by law, you are supposed to show me where in my medical chart. Medical records if you'd like to, and they can send whatever results. No, I want to see it right now. That's not an option.
This is Emily Morlock. She was the patient, and in November, she had gone into the Highland ER, which is in Rochester, New York, with complaints of tonsil stones.
I will say I saw the update video from the patient. And her excuse was, I went to the ER because Google told me to.
She was examined by 2 different providers. They looked inside of her throat, did all the things that they should have done, and then ultimately decided that they weren't going to admit her, and they sent her a referral for ENT.
Which is what they should have done.
Which she did not like. She began raising her voice, arguing with everybody, recording, including getting other patients in her video. She refused to leave the hospital, said they aren't providing adequate care and that she's been traumatized by them. And I have to give the nurse so much credit because she was very assertive, she was polite, she was respectful, but she also refused to be her punching bag.
This is report here. Yes, I can. You cannot, because there are other patients around. I don't care. No, you cannot. Stop, Sylvan. You cannot. I'm not done speaking. When I'm done, that will be your turn. You cannot record where there are other patients. So this is closing because you cannot record other people in this department. If you want to be on this side as her family member, that's fine. The providers came over, and I'm not finished. I know you're about to say something. And there's a difference between there's nothing wrong and there's not an emergency that needs to be admitted to the hospital. So they explained to you that they will send you to ENT to follow up because I'm not finished yet. You've had this problem going on. There's nothing that they see that is emergent. And I explained that literally because of this problem, get down, there's no need to yell. Because of this problem, I have been having problems sitting because literally these specialists are so backed up, they cannot schedule me. I got an email from the colonoscopy being like, we can't schedule you yet. We're so backed up, we can't. So what am I supposed to do about the hole in the back of my throat that keeps on getting stuff stuck in it, that makes it so I can't take my pills easily, so it makes it so I can't eat easily, so it makes it so I can't do a normally bodily function easily, things I need to do to function on a day-to-day basis. What am I supposed to do as you guys continue to ignore it because I can't get in to be seen on a normal time? And then I come here when I Google it and it says, this is an emergency.
Google is not.
I don't care. I don't care. But this is the
This
thing.
girl's a
That
whole
is the
nightmare.
only place I can get information right now, because it's the only place I can go to, because I can't get in to see your doctors.
I understand that.
I can't get in to see your doctors, so
Sylvan, you have
Google
to
is
let
the
someone
only.
else speak.
No, because
Then
no
I'm
one,
gonna step
no
away
one is
because-
listening to me.
But you're not listening to us either.
I actually have been for months and months and months
I've met
and
you
months
an
and
hour
months.
I do understand that it's frustrating that you cannot get into the doctor that you want to get into. I also understand that it's frustrating to me to be on record when that is not allowed. And walking into this ER, there were multiple signs saying you're not supposed to record.
Yeah,
I understand.
well, you're
Okay,
also not supposed to refuse to treat me.
I didn't refuse to treat you. Neither did the provider.
I have gotten absolutely zero. I have absolutely.
I think she did everything a nurse is supposed to do. She listened, she validated her feelings, explained things in a way that a non-medical person could understand, but she also said, hey, look, if you're not even going to let me speak, then I'm going to leave. Because effective communication is a two-way road, and she doesn't have to sit there and just be verbally pounded, and so she wasn't going to do that. But she did all of those things while still being professional and respectful to the patient. But despite all of her attempts, she would not back down, and she continued to refuse to leave, so security got called.
How are you?
Yeah, we're not going to worry about the security part, but she did call security, and she did get removed by security. But I can honestly say, she did do her due diligence of trying to educate and de-escalate.
Some concern about a lot of these similar complaints even before this tonight.
So this one, I started on the patient's side, okay? And then went to the doctors, because I firmly believe that you should be able to ask for any test that you believe could be wrong. But this woman brings up that I was hit in my spine and now I am completely paralyzed, even though she walked in and is moving her hands, and she has moved her feet.
Right? You've been seen by POA. There's a lot of, I saw in the notes there that you were talking about your
I actually just got assaulted by a woman at a concert at a venue. I'm represented by a person. What's your name again? Samantha. Please stop talking. What's your name again?
I'm Dr.
I need an MRI immediately from my injury I just received at a concert in Ocean City, Maryland, with tons of witnesses. I cannot walk. I am paralyzed. I was just screaming on the x-ray table, having to turn left and right, unable to feel my legs. I am going to be taking care of two of my twins. I need an MRI immediately. I was just assaulted at a concert with hundreds of witnesses, and I need an MRI immediately for the injury to be reported and documented legally, or this is medical malpractice.
Okay. I'm probably more concerned about your mental health. Do you want to, I'm wondering if we need to go down that road a little bit. Okay, because you have these fixed delusions of somatic complaints. I've seen it in your chart up to 3 or 4 days ago. This is very similar to what even before any of this happened. These are similar complaints and similar things that you expressed. I saw that you got seen by Peninsula Orthopedics 2 weeks ago.
What does this have to do with me just being assaulted at 9:45 p.m. at the boardwalk? I was just assaulted at 9:45 p.m. I was just assaulted. I cannot walk. I am now paralyzed. I cannot walk. What does this have to do in regards to my mental health?
You have fixed. What I'm seeing in your history is you have a lot of these fixed somatic, which means physical complaints, that you keep going on about and you get fixated on.
What am I supposed to do right now? I cannot walk.
Okay, we've seen you walk twice. You got up on the table to go to the x-ray table. You got off of the stretcher by the ambulance and you sat down in this wheelchair.
I cannot walk.
I did too.
I'm Dr. J Mack. I'm a board certified emergency physician, and I think that Dr. did a really good job. He stayed very calm the entire time. He wasn't overly confrontational, and I'm not criticizing what he did by any means. I just want to share with, EMS, nurses, other doctors out there that deal with situations like this, something that has been really successful for me as an emergency physician. And that is to be 100% upfront with the patient about what I want to be able to do and what I can do. So by that, I mean, I'll tell the patient, I want to fix you. And I do. I sincerely do want to be able to fix that patient's problem that night. But then address the fact that they were just seen recently. They just had a total spine MRI that was negative. And we just need to be realistic about what we can do in the emergency department at 1:30 in the morning, which is when this encounter was. It's just not realistic to think that this long-term issue can be solved in the middle of the night tonight. We want to do that for you. We sincerely want to do that for you. Now, obviously, this patient came out swinging, so I don't know what anybody could have done or said to make this patient happy besides get a full spine MRI in the middle of the night. Thank you to Dr. and all the frontline responders out there who deal with situations like this on a very regular basis.
Some concern about
Like some of these are pretty wild.
Dr. Zadie.
And your name is?
David.
Your foot. David who?
He's
my nursing student.
He's a student.
He's just a
And
student.
you're Rhonda, right?
You got it. Let me see your foot.
Have at it.
How long have they been this color? You said?
Approximately a week or
Week?
two.
Was it after you were discharged from Cedars?
I was then transferred to another hospital.
Is it on the bottom or where?
I think
Oh,
you
your
could.
toenail?
Yeah.
Your toenail?
A discolored toenail.
And I'm having bladder pain. And I'm
Has
having
nothing to do
lower
with your
back
foot.
pain. And I'm requesting a PSA.
So, this is where this becomes problematic. Is because a PSA is not something that anyone will rush. They want to do other tests that they can rush to get the results of. And trying to explain that doing a PSA, you're not going to get what you want anyway. Let's run these other ones so we can get the results.
Oh, I can't. So I can't get a PSA. Is that correct? I'm having bladder pains, and I can show you discoloration in my urine.
We can order it, but it's not going to get read immediately. It's not
It's a routine
Uh-huh.
order? Like
It's
it
not-
doesn't go with stat.
It's not an emergency, like I was saying
Oh, it's
before.
not an emergency?
No.
Oh, so the discoloration in my urine,
Give me a second.
my lower back pain, and my fear that I might have cancer is not an emergency.
Okay. Hang on.
Is that correct?
PSA is not an emergency.
I will be right
There's
back.
different ways to check that. We check a urine sample, we make sure you don't have UTI or something like that. But the PSA,
I'm not concerned with a UTI. I'm concerned with cancer. Abdominal cancer. I'm
then that would
concerned,
be, then that would be a CAT scan. That would not be a PSA.
and I already took CAT scans. I'm interested in a PSA.
But I'm telling you that we can't get that test done today, right? It's a
Not
routine.
today, but when can I get it done? As soon as possible.
So your primary usually works, like I was saying.
But my primary is not doing anything for me. That's why I'm asking you.
So that's why we can order it, but we can result it with your primary. They can call you with the results because the result won't be back today. That's what I'm trying to tell you.
Okay, as soon as possible. You do whatever you gotta do.
We'll order it, but we won't get the results.
All right, and what do I do about my bladder pain?
You take baclofen, right?
That's not helping. And the bloating every time I eat, and the discoloration in my urine, and the incontinence, and all those issues that I've expressed. The ongoing problem. What are you going to do for me about that? Are you going to tell me that the ER doesn't do anything, or because I'm handicapped I can't get any help with that?
We didn't say any of those
We
things.
didn't say that.
Okay.
Your feet are warm. They look pretty good.
You have good circulation, which
Yeah,
is great.
they're
That's
warm.
good.
They feel good. They're not. They don't look bad.
It looks like.
Can you resolve that issue?
Which issue?
The discoloration.
Did you hit your foot on something?
It looks like
Yes.
a bruise. Yeah, it looks like you bruised your toe.
Yeah.
So it's your toenail, right? So the main thing we worry about is if it's the skin or if it's like kind of like the toe digit or the toe itself or the foot.
So you think it'll just heal naturally? Can you give me some kind of medication for that?
So if it's a bruise on the toenail, so usually it's a blood collection that's just kind of up against the toenail, and that'll resolve on its own. There's nothing they really give for it.
Okay.
If it was on the foot or like the actual toe itself, then I'd be worried about like gangrene or something
Okay.
like that. I don't see that.
What about my bladder issues?
That we would probably need to get a urine sample.
All right.
Test your urine.
Can we do it right now?
Sure.
And then you have time constraints, right? You have to catch transportation by 5 o'clock.
I'm not concerned with that now. Now that I got you in front of me, I'm concerned with dealing with you. I'll worry about getting home. I'll pay for an ambulance or whatever.
Yeah. No worries.
Your name is again?
Why did it go from the toe
Dr. Z.
that you admit that you hit
You're Rhonda and you are?
to I think I have stomach cancer
And what room
to
is this?
why
Room is 14.
is my pee funny?
And where am I?
How does that?
Okay, the ER at the main
It's
hospital
like here
at
in
the Veterans
Danny.
at Loma Linda.
That's where you are.
Correct? What floor?
Pardon me?
What floor exactly?
The ER?
The
ER.
Okay.
You're not supposed to be recording.
Who said I was recording?
You have that aimed at us.
Are you accusing me of recording?
I'm asking you, are you recording?
Do I need a lawyer to answer that question?
Yes, she's accusing
All
you
right, so
of
then-
recording because you are.
Don't,
You're supposed to,
don't,
this, because it violates. what
no,
we're
you're
talking about.
violating me by accusing me of doing something.
Okay.
I'll get my lawyer to, and please help me with the issue. And Rhonda, please don't accuse me of anything.
We're gonna help you, sir. Okay.
Thank you.
So this next one, I am pretty sure is a skit. Just because of the way that it's laid out. But I do know that this happens. I've been in the hospital before and yelled at another patient because of how they were treating somebody, because of how they looked and what their race was. And it's disgusting behavior. It doesn't. Ethnicity and color does not matter. Especially coming from a physician. They are still going to be able to treat you. They are still human. They are still qualified.
Oh, no. I want another nurse.
Okay.
Sorry, I need another nurse.
Oh, my name is Nurse.
I don't care what your name is.
I
don't want you to be my nurse. I want a different nurse.
Okay, I understand.
Get
but
a
I
different
would have
nurse
to do
now.
your admission.
I don't want your admission. Get it out.
Okay. Is there a reason you?
I
have
don't
to be
want
nurse?
you to be my nurse.
All right. I'm gonna have to check if there's another nurse
You do
that I
that.
can get. Okay.
Get another nurse.
Because everyone is busy right
Well,
now.
I don't care how busy they are.
Okay, I do understand, but give me just a second. I'm gonna check if
This is
we
why
have
I would
any
not be able to
admissions
hold my
nurse
temper.
available.
That's
right now.
fine.
All right, give me one moment. Here's Dustin. Are you available right now?
But I do think this one was a skit. But if this does happen.
I'm typically doing his admissions, but he didn't want me to do that. Mr. William Smith.
Oh, okay, Mr. Smith. Hey, how's it going?
Mine fine, and I don't want you as my nurse either.
Okay.
I don't like your outfit. I want a different nurse.
Okay, what seems to be the problem?
I don't want you as my nurse.
No, it's okay.
Do not touch me. Do not talk to me. Get somebody else in here now. Get someone else in here now!
Available at this time.
Well, that's too bad.
They're working with other
Well,
other
you're gonna need to get them in here.
Can I adjust the
No,
bed so
you're not
more
gonna adjust
comfortable?
anything. You're not gonna touch me.
Here, I
Do
can-
not speak to
I
me.
can move
Don't touch my bed.
Okay, okay.
Bring it back up now.
Alright, yes sir. Okay. Can I just get just basic info?
How would you like a mouthful of teeth?
Sir, there's no need for that.
How would you like a mouthful
Sir,
of
I'm gonna
teeth?
need you to calm down.
I'm gonna need you to get out of my room now.
Okay, look, sir. I just need basic info.
You're not getting basic info.
Look, I've been a nurse here.
I don't care how long you've been a nurse here.
Look, I know I look young. Okay.
Get out of my room now.
Mr. Smith, I'm just.
Get out of my room now.
Would
I
you
want
like
a
to see-
different.
would you
I
like to
want
see a
you
doctor?
keep interrupting me. I want a different nurse.
Okay, there's no other nurses
Get a
available.
different
Would you
nurse
like
now.
to see a doctor?
Get a doctor in here now.
Okay, all I need to know is like.
Get a doctor in here now.
I need basic info.
No, you're not getting basic info. You're gonna get a basic mouthful of teeth is what you're gonna get.
Can I get a doctor?
It's about time.
Yeah, no, all's
Like I
fine.
said, I'm pretty sure this is a skit, just because it was actually recorded. But
Patient has refused service.
What seems to be the problem?
No. That's not the kind of doctor I want. I don't want somebody like you. I want a different doctor. Get a different doctor in here.
Sir, I am.
I don't feel comfortable with you.
Sir, I'm just
I
on.
don't
I'm
feel
on.
comfortable.
I am on this.
I'm scared.
I am on the same.
No.
and let me just say this: if you can be this picky, just from the look of your medical staff, you don't need to be in the ER.
I don't care.
I went to the same med school as everyone
You did
else.
not.
I
You
passed
did
the
not.
same test.
I don't believe it. I do not believe it. I think you guys are here to hijack me.
Sir, we're just trying to help you.
You're gonna do something to me. Get out of here.
I just need your age, sir. Age, basic info.
You're not getting anything.
We can weigh him on the bed.
Get.
Okay.
Do not touch me.
I won't touch you.
Do not touch me.
Sir.
Do not touch me. Get it out of my face. I want a different doctor now.
You have high blood pressure, sir.
I do not have high blood pressure. I do not have. Get a different doctor.
Oh, Dr. Escobar.
I'm not dealing with this.
Can we get a doctor?
Oh no.
I do know that after this whole thing, they had him discharged and then removed by security.
Oh no, I need to have her seen today. Oh, we're kind of booked.
There are walk-in clinics for this purpose of what you're about to see here.
Today, I don't know if we can work her in today.
No, I'm too baby. Yeah.
Okay, well, today is the only day. Like, I have to have her seen
We
today.
got
I have a meeting
one
tomorrow.
more.
Okay, and I'm
That's-
actually
that's-
flying
then we're
out
done.
Sunday. I totally understand this, but you do this every time. Like, you always bring her on a day that it's not her appointment, and you always want us to work her in. I know that, but I am very busy. Like, I'm so sorry, and my life is just so hectic right
Okay,
now.
I understand that, but-
Yeah, because I'm traveling all the time, and I have to take care of my mom, because my dad is not here, so I just, can you guys see her today?
I totally understand all of that, but we have a job we have to get done, and we don't have an opening today. We're booked, so she's gonna have to come to her appointment on next Tuesday.
Okay, so I'll tell you what. Call Dr. Moore up here.
Dr. Moore is not here today. He has someone in place for him today. Somebody's subbing for him today.
You guys are
But
gonna
he will
see.
be here on Tuesday.
No.
She can come to her appointment.
No. You're not gonna see her Tuesday. You're gonna see her today. They are rolling her up here right now, and you're gonna see her today.
The entitlement.
She will be seen today. Let me call Dr. Moore because
Dr. Moore, he is on a family emergency. Do not bother him.
And this is a family emergency. Oh no, I need to have her seen today.
Oh, we're kind of booked today. I don't know if we can work her in today.
They call you an asshole.
Been called a bitch 1,000 times.
A knocked up whore. Get the F out of his effing room, you effing N-word.
I've been bitten, choked, punched in the mouth.
I had a guy try to kick me in my stomach while I was pregnant.
That poor nurse at your bedside has probably been through hell with the last 10 or 15 hours, and then you come in demanding ESPN? Are you kidding me?
And it's like, well, yeah, I got punched in the head tonight. And any other job would be like, what are you talking about?
They call you an asshole.
Been called.
Yeah, I just want to make sure that everything was very well rounded. I'm not dogging on professionals. Okay? I am not. I'm just talking on shitty people that should not be in a caring field. I am extremely blurry. I'm going to get this whole thing fixed before I go live tomorrow. It probably just needs unplugged and replugged in. I have no idea why it's doing all that. Make sure you like, subscribe, all the things. I'm going to do my very best to come back on tomorrow. Probably not quite as late. Yeah. And then tomorrow, what I plan on is, I feel like everybody has just had so many heavies lately. We're going to do like some Reddit reads. And then just some like feel-good videos and giggly videos for us to judge people on. So yeah, that's what I got planned out for tomorrow. So if you guys want next week, for Sunday, if you want one of your things covered that like you're going through, you think needs more education, let me know. Yeah. And we'll get people educated for you, because I know it's hard for me to explain a lot of mine. There's still one more of mine I didn't get to tonight, but like, I'm tired, y'all. Just let me know. You can DM me on TikTok, Discord, any of the things. So, I love y'all, and I will see you tomorrow. Bye.
And if that means I gotta do this by myself, living since I was a child, couldn't be myself. Had to represent the image of someone else. Now it's time to take control of my mental health. I can't believe I even let this all affect me. I don't wanna be like nobody else. I wanna be different. And if that means I gotta do this by myself, well then I'd rather be a misfit. Had me feeling like I never deserved this. Everything I do is absolutely worthless. Turn around and feeling like I was deserted. Had me feeling like I had to leave this earth, kid. Now I'm looking at the world through a new lens. Had to gotta separate for some new friends. Feeling better now, I just wanna let you know. Don't cry when they find me on the phone. If you don't understand what I'm saying, one day you'll find out. Eventually the greedy need a bigger mouth. Chew you up and swallow, then vomit.